All right, guys, how's it going? Dr. Natty here at My Kinetics Physical Therapy and Performance. My apologies. This is my first time live streaming, so I'm really excited and nervous at the same time. I know I messed up the first one, so this is the second attempt to go over the live stream again. So again, it's my first time. Like I say, I'm Dr. Natty. At MyoKinetics, we specialize in season-ending injuries. So something like ACL tear. This is what our bread and butter. And my main goal today is to really educate you guys on why ACL re-tear happen after you just go through this gruesome, episode of your life of just, you know, um, overcome your ACL injury. So I want to just dive into a little bit of this topic, just because it's happened more common than ever. I know, like most of the athletes that we get to see, they're coming to us after their ACL, and the biggest fear that they have is like, what if this is going to happen again? And how can I prevent this from happening again? And this is why we're doing this live stream right now. So again, a couple things I want to get in touch with and just start the live stream with some stat is that most of the time that the ACL re-tear happen far more common than what we expected, right? Because if you go back to how you tear your ACL, most of the time it's non-contact, right? Where you just kind of plan and pivot. Next thing you know, your knee just give out, you feel that pop. And next thing you know, you're on the ground, you're like, what just happened to me? And it's devastating. Now you just got your surgery, you're doing your rehab, which can take 9 to 12 months. And the last thing you want to do is go through this whole thing again, right? Now, one stat I want to share with you guys is that when it comes to returning to sport, if you go back before 9 months post-op your ACL reconstruction, you have 7-fold increased rate of a second ACL injury. So I'll say that again. That's 7-fold, 7 times if you go back before 9 months. Why is that? So first factor I want to address is the graft, right? Because the graft itself is soft tissues, right, that you can get from your patella, your quad, your hamstring, or cadaver, right? That graft needs to actually turn into your ACL ligament, right? So when most people tend to go back to their sport, most of the time, by the time they're 8 months out, they feel really, really good. That means you feel like, oh my God, my strength is back. I can move, I can cut, I can do all these things. But guess what? With that being said, you might having a hard time understanding what's going on with the graft. When you feel really good, that's why I tell my patient, that's when your graft is at the weakest, right? So you need some time for the graft itself to turn into a ligament. And that takes between 9 to 12 months. So if you go back before that time, your graft is actually at the weakest point where you might physically feel the strongest. This is where some PTs might miss the boat on, because you're able to go do all these things. You can run, you can jog, you can jump, you can land, but guess what? You're not ready to go back to that, game setting, high intensity, high level competition. So that's why the injury happened. So that's the first thing I want to address is going back before 9 months, increase 7-fold of the second ACL injury. And the second ACL injury could be on the same knee, or it would happen on the other knee. Right now, why does that happen? Right on the same knee, we already talked about the graft itself as being weak, and therefore it just tear. It just can't withstand the force you're producing. The analogy I like to give my patient is like you are a car with a V8 engine, but your body right now is kind of like a smart car. What we really need to do is to build foundation, give you that extra 3 months to turn that smart car into, let's say, a BMW or a race car or a NASCAR, to actually support the engine that you have, right? That's where the graft coming. And the second point why you would tear on the other knee is because you're overcompensating with the other side. Overcompensation happens when you actually favoring the other side way more. So if you have an injury on the left knee, you tend to favor the right knee a lot more. And without true testing, you wouldn't even know that you're doing that, right? Our job as a physical therapist, my job here at MyoKinetics, we want to point out those flaws that you have right now so we can actually address it immediately. So by pointing that out, we want you to actually build trust on that injury leg. So that way you have 50-50 weight bearing when it comes to cutting, moving, pivoting, and then jumping up and down. That's a huge thing that we're looking for. Okay. So my goal for this, and my goal why I do all what I do on this channel, is to actually decrease the number of ACL tear. And especially when it comes to second tear, because the first tear, there's not much we can do. The damage is already done. The second tear, we can actually do something about it as a healthcare provider. That's my goal, right? So that's the first stat I want to provide you guys. And the second stat, another thing that I tell people all the time, is that just because you're clear from us and you're going back to sport, that doesn't mean you're done doing all your ACL exercises that we have been giving you, right? You actually have up to 2 years. So another alarming stat is that within the next 2 years, you have an increase risk in tearing your second ACL injury, right? Because most of the time you kind of just put everything that you did in the back burner. You're no longer talking to the physical therapist. The stuff that you used to do to get you better as an athlete during your ACL recovery, you stop doing, right? It's similar to someone who have set a weight loss goal. They want to lose 20 pounds. After they hit that 20-pound weight loss, they kind of stop doing the things that got them that 20 pounds to lose 20 pounds in the first place. So they stop working out. They stop eating healthy. They stop going out for walks, right? So these are things that I want you guys who are listening to this to understand. This is a lifelong process, right? And you might be like, oh my God, that sounds horrible. Like I have to deal with this for the rest of my life. And again, if you're an athlete, our goal is to make you an athlete for life. You want to be athletic for as long as possible. I'm 35. I still train like how I was when I was a high school and college athlete, right? Because the more athletic you are, the better you are it's going to be in life. And if you keep treating your body like you were in PT the whole time, guess what? Your body's going to feel a lot better, right? Another statistic that I want to point out. So that's the third one now, is that the knee that you guys have ACL on, that knee's at risk to have osteoarthritis. So pretty much just some wear and tear in the knee, right? Because you have some drilling inside the knee. That's how they plant the graft. So the bone itself is at compromise, right? So what we want to do, we want to be able to show you and teach you ways and tactics on this channel to make sure that you are actually taking care of yourself throughout your whole lifespan, right? Right now, you're watching this. You might be a high schooler. You might be in college. But guess what? You're going to live a long life, and you want that life to be really up to your own terms. You want to be able to travel. You want to be able to enjoy your life the way you want. And this is why it's important to know these three statistics, right? So the first one, to recap, going back to earlier than 9 months, that's actually going to increase the risk 7-fold, right? And then if you don't continue to do the exercises and continue to work on your weaknesses within the next 2 years, you also have a increased risk of tearing your ACL and another ACL. And the last thing is that you have increased risk for osteoarthritis. I know that sounds really gloom in the beginning, but now I'm here to tell you different ways that you can actually know when you're ready to go back to sport. So when you're a patient here and you come to us, we like to make sure that you are ready to hit the field. When you are ready physically, mentally, that's when the decreased risk of ACL tear will happen, right? So in here, I'm going to show you guys some of the stuff that we have here. So this is our return to play testing here. You can see that it's really, really long, but these are our checklists that we like to have. So that way we can objectively tell you that you're ready to go back to your sport, right? If you're in PT for this right now and you feel like you might be behind and you're not doing good enough and all of that stuff, these are some things you can ask your physical therapist, your surgeon, like, hey, when am I going to be able to do these kind of tests? And what we like to do as well, we send these kind of report cards to the surgeon themselves, so that way they know how good you are, right? The issue with going back and see your surgeon is that they only get to spend maybe half an hour with you, and they're not going to be able to give you the full detail of what's going on, right? They don't get to see how you move. Us as physical therapists get to see how you move on like a weekly basis, and we have a better baseline to know what's going on, right? The one thing we want to look for, and this is how we determine how strong you are and how ready you are to go back to running, right? So we're looking at your quad strength. Your quad strength is how good you are at extending your knee. Can you kick your knee up compared to your non-op side versus your op side, right? So the non-op, which is the knee that did not get hurt. The op side, which is the knee that got hurt, right? That's your operation side. So for us to return back to running, we want to see 80% close to the non-op side. So let's say, for example, if you're able to produce force at 100 kilogram, 100 pound on your left knee, which is your operation knee, right? We want to see, if your right knee is your non-op knee, able to produce 100 pound of force or like 50 kg of force, we want that to be at 80%. So you got to be at 80 pound of force on that. Once you show us that you're 80%, strength close to the other knee, then we say, hey, you know what? You're ready to actually go back to running, right? That's how we quantify objectively without giving us our opinion, right? Because there's quality of movement and there's actual strength. The way I look at it, it's like taking an exam at school, right? You might think you know the material, but how good are you at knowing material is depend on how well you do on the test, right? And all these tests that we give, these are tests that we're actually building you up for, right? So we're not going to have you do any testing that we haven't prepared you for, right? So if you're in PT right now, you should ask them like, hey, when can I start doing some open chain exercise, which is some knee extension machine, right? Which we see at the gym where you kick your legs up and down, right? So that's actually going to help you build your quad strength. The more you do that, the more quad recruitment you're going to get. The more quad recruitment you're going to get, the stronger you're going to be when it comes to your quads, right? So that makes sense. Second thing we look for is not just the quads, it's actually the hamstring. How strong is your hamstring in relation to other hamstring, the opposite hamstring, and in relation to your quads? The one thing I like to talk about, and no one really mentioned this, is that the hamstring itself, which is the back of your knee, is your best friend when it comes to ACL rehab, right? Because the hamstring acts as a brake mechanism when you're slowing down. So your goal muscle is your quads. So right, you guys heard the phrase all gas, no brake, right? All gas, no brakes mean you have all quads, but weaker hamstring. Ideally, you want to have a 2-to-1 ratio. So if your quads is at 100 pound of force, you want your hamstring to be at 50% of that, right? So that's 2-to-1. So if your hamstring can actually withstand the force of the quads, it's going to help you decelerate. It's also going to help you slow down when it changes the direction. Most ACL injuries happen, especially during non-contact. It's when you're slowing down, turning, and pivoting, right? That's where the hamstring come into play. So we're able to identify that you have good hamstring. Now we can say, all right, now we're going to check another box. That means now you're ready to do some cutting and deceleration and all of that, right? So we're looking at 80% quad to quad, and then 2-to-1 ratio, which is 50% of the hamstring to the quad itself. So that's the first checklist that we do in first and foremost. Then as you get better at that and you get to go back to running and stuff, now it's become more quality of movement, right? You yourself should be able to record how you run, how you walk, and see if you're favoring the opposite side, right? We talk about it in the beginning before, when if you actually favoring the opposite knee and you go back too early, that knee has that high risk of re-tearing or tearing that ACL. So we want you to stay as even as possible, right? Because in any athletic events, you're most likely going to be on one leg, right? When you run, you're on one leg. When you cut, you're on one leg. When you jump, when you land, rarely you're going to jump and land on both legs, right? So we want to have you reach those baseline first. Now, as you get better and better, we're introducing some plyometric, right? Jumping, landing, hopping. These are things that are extremely important, because the next phase of testing for us would be a hop test, right? Can you generate force on one leg, and can you land on that leg, right? So there's 3 criteria for the hopping that we do, right? So the first one is a single leg hop. And we look at how far you can jump from on one leg and land on the same leg, and then compare that to the other leg, right? And what we want a 90% criteria. So let's say if your right leg is your non-operative leg and you produce, let's say, like 50 inches, right? We want to make sure that, 50 inches is too short, but you get the point, right? Let's say 50 feet. We want to make sure that when your left leg, your operation leg, is jumping, is at least 45, right? Because that's going to give us an opportunity to see how good you are, how much you trust that leg. Can you produce the force? Because if you can produce the force on your operation leg, guess what? You're going to favor the opposite leg way less. So that's give you more confidence as well. Okay. From the single leg hop, we're going to go into a triple hop. This is how much can you jump 3 times in a row and then stick the landing. And it will measure the distance once again, right? We'll compare the operating side to the non-operating side, and we want you to be at 90% compared to that. The third test will be a crossover test, right? So you're going to hop in a zigzag motion. You can do it 3 times, and we're going to measure the distance, and we're going to say, okay, good. Are you at 90% closer to your non-operated leg? The last hop is the time hop, which means we're going to set you up at 10 feet, and we're going to time you. How fast can you hop over on one leg in compared to the other leg, right? Because if you can hop just as fast on your operated leg compared to the non-op leg, guess what? That means you're actually utilizing that leg, and you're actually feeling confident and strong with that. So that's like the most basic criteria that we like to test when it comes to readiness, right? We usually try to go in advance here at Myokinetics. So we'll do like vertical jump. How high can you jump on your operation legs compared to your non-operation legs? Because those jump will actually go, we can measure the time you spend in the air and how long it's going to take you to come up, go up and come down, how much force you can produce, right? Because those are all relevant statistic that we need to actually make a determine if you're ready to go back to sport. You know, sometimes in physical therapy, I have to play a bad guy by telling the patient like, hey, you feel good, you look good, but the data doesn't show that right now. So we just need a little bit more time for you to feel confident, right? The one thing we really like to do now when it comes to testing with ACL. Oh, you see my dog here, Cody. He's always with me. So here you go. Say hi, Cody. The one thing we like to do, and we're actually collecting some data on this, is single leg depth drop. Can you jump from a height, which is 18 inches, and land safely without losing your balance? And can you maintain that balance for 10 seconds? That gives us a lot of data to see how confident you are if you were to be shoved, pushed, and you have to land on one leg. Can you maintain that balance? So that way you can actually regroup your body and then continue with the game. So those are the 4 things I really like to look for when it comes to data, right? If you have all the data and the know-how, that means you're physically ready, right? So physical is one component. The next one that no one's really talked about, and I see a lot of you guys ask questions on the comments or even on Reddit when I see this, is mentally. Are you mentally ready to go back to sport? The late stage of ACL, especially from 9 to 12 months, is all about what's up here, right? And what's up here indicate how confident you are in trusting that knee, right? Because think about this. The way I like to tell my athletes is that, you know, when you have your ACL tear, especially as non-contact, it's kind of like your best friend backstabbing you in the back. Your body just kind of fail you. You don't know why, and you're just kind of bitter, you're angry, and you're frustrated. And you know, like, you're asking yourself, how do I know that's not going to happen again, right? So building trust with your body itself is a huge component, right? If anything, it's probably the biggest one from 9 to 12 months. So what we like to give our patient here is this questionnaire that you can actually look online and you can fill out yourself. It's called the ACL RSI right there. So in the ACL RSI, there's 10 questions you can answer, and it's going to grade you from 0 to 100, 100 being 100% fully confident, 0 being not confident at all. So I'll read some of the questions to you guys just because this is something that you need to ask yourself as you're watching this video, right? So the first one is say, are you confident that you can perform at your previous level of sport performance, right? That's just answers from 0 to 100, 100 being fully confident where you're at. The next one is that, do you think you are likely to re-injure your knee by participating in your sport? That's a big one that we look for, right? If we see someone that at a 50%, I would say, hey, can you tell me a little bit more about that? What about your sport do you feel, you know, unconfident by, right? Which part of your sport? If you play soccer, is it when you're kicking the ball? Is it when you're going out for a header, right? If you play football, is it when you're cutting? Is it when you have to decelerate and pivot, right? So these are something that's good to understand. And it's actually as an athlete, it's forced you to dig down, dig deeper about certain things in your sport that you're not good at. So that way, we as a physical therapist can talk to your coach, talk to your athletic trainer, right? To say, hey, so and so is really having a hard time doing this movement. Can you keep an eye out on us? And if you're telling us that, hey, I'm really having a hard time jumping and landing and then heading for the ball, guess what? We're going to do that in PT. We're going to do that to the point where you can say, you know what? I feel 100% confident, right? The third question is, are you nervous about playing your sport? That's huge. And we're talking about nervous in game setting, right? Hey, when the lights is when you're on when you're playing at night, the lights are on you, you have the ball, there's like 2 minutes left in the game, you're down 1-1 score. Do you feel nervous? Right? Of course, the answer is going to be yes. But are you nervous based on your knee, or you're nervous based on the circumstances? Right? If you're nervous based on your knee, then we need to push you. We need to mimic that game time scenario. So what we like to do, right? If someone say, hey, I'm really not confident on the last 2 minutes of the game, and we ask, okay, tell me what happened the last 2 minutes of the game. Like, well, I'm really tired, right? I can't think clearly, and I usually get fatigued quickly. So what we're gonna do, we're gonna make sure we mimic that state, right? So we get you really tired, and we say, hey, we have 2 minutes left. It's a 2-minute drill. We're gonna do this, and let's see how you respond. And as we're doing that, we're exposing you in a safe context environment because you're working with your PT. And then from there, we get to give you feedback like, hey, like at a minute and a half, you started doing that. You start going back to your old ways of running, cutting, and jumping. I was like, hey, when you're tired, focus on this. Focus on like, hey, as soon as you head the ball, when you come down and land, make sure you land softly. Boom. Right? So now you get more confident. Fourth question is like, are you confident that your knee will not give away by playing your sport, right? That's a big one. Like, do you feel like your knee going to buckle, this and that? So what we like to do, we expose you to different scenario that your knee could possibly buckle, right? So for us, it's always contact. So we like to introduce contact in context of your sport early and as part of your ACL rehab, right? So I'll be shoving my patient all the time. I'll be making contact with them. I'll actually play one-on-ones with them. I'll push, I'll pull, right? The jersey, because again, when you're in a competitive environment, people don't play fair, right? So we want to prepare you for that. The fifth question is, are you confident that you could play your sport without concerning for your knee, right? So that's a good question. Like, are you constantly thinking about it while you're playing, right? And clearly, if I ask you 6 months out, you can say, yeah, I'm going to think about it. But what we want to do this every single month, and we want to see the improvement that you're confident, right? So as I'm pulling your jersey, as I'm pushing you, as I'm shoving you, are you thinking about your knee, or you're thinking about what you need to do to protect yourself, right? That's a good place to assess yourself. Sixth question is that, do you find it frustrating to have to consider your knee with respect to your sport, right? So it's like, is it frustrating that you feel your knees holding you back, right? Especially those who play with their knee brace. Knee brace is, is a question I get all the time. Like, should I wear my knee brace? My answer is like, it's up to you, right? If you have to wear your knee brace in the beginning, great, that's fine. But as you get better, you should slowly wean off your knee brace, because I look at knee brace as almost like a target. If a competitor see you wearing a knee brace, guess what? They're going to go after that knee because they know that you're weak side, right? So our job is to eliminate all the weakness as much as possible. And that way you don't feel like your knee, that leg is actually a shackle to you. Okay. So we got 4 more questions to go over. Next one. Are you fearful of re-injuring your knee by playing your sport? Again, same scale. Like this is stopping you. Are you constantly thinking about it? Are you nervous about it? Right. So we want to see you going up on that scale. Are you confident about your knee holding up under pressure? Same thing. Game time scenario. Can you actually rise to the occasion, or you actually settle back down? I learned this in sports psychology, where you have good anxiety and bad anxiety, right? Good anxiety is mean when pressure's coming down upon you, you can rise to the occasion because you know you can actually conquer that anxiety. Bad anxiety is mean when you have a lot of pressure on you and you have no way of overcoming that. So we want to slowly expose you to those anxiety provoking situation, so that way you feel a lot more comfortable when it comes to, perform under pressure, right? And then the ninth question is going to be, are you afraid of actually injuring your knee by playing your sport? Right? Again, do you think that because you play that sport, that's why your knee hurt? Right? That's a good question to understand, right? If you're afraid of playing your sport, it's really hard for us as physical therapists to clear you to go play that sport. That's why we develop a system where, you know, what we don't do is we don't cut people off and say, hey, you've passed all these things, you're good to go, boom. And that's it, right? What we like to do, like, hey, you're here now, you're doing really well at this. Guess what? Next week, you get to go and do a warm up with your team, right? So now we're actually exposing you is a graded exposure to what you used to, right? So we'll get you to go do warm up with your team. Then we'll get you to go to non-contact drill with your team, right? And then a week or two later, we'll say, hey, you know what? You look really good. Let's clear you to do some one-on-ones, 2-on-2s, 3-on-3s, and see how that goes. And we'll keep you there for about 2 weeks, right? And then from there, you get to come back and tell us, hey, when I was doing 2-on-2 drill, I was really nervous about this. Can we go over this in my PT session today? Great. That's what we're gonna do. We're gonna go over that, right? And then another thing we would do is once you're able to do those drills, we'll say, okay, you know what? It's time for you to do some scrimmages with your teammates, right? So this is where I will probably call your coach and say, hey, coach, so-and-so is ready to go back to some scrimmages. Can I have him or her only participate 10 minutes in the first scrimmage just to see how that looks? And I also get feedback from the coach as well and from the patient to say how they feel in that 10 minutes. If they say, hey, I feel really good with that 10 minutes, well, guess what? You earn the right to earn an extra 5 minutes on the next scrimmage. So we slowly build your way up, right, through graded exposure. It's kind of like if you haven't done a new skill, it's like riding a bike. If you, I haven't ride a bike in like what, 10 years probably. The first few times, I'm gonna be like a little shaky and rusty at it. But the more I keep doing it, the better I'm gonna feel, right? So it's the same thing. It's like riding the bike again. And if you've been working with a good physical therapist, you know that they probably instill in you ways to move, how to move, right? What to think about. So that way you're developing new movement pattern, right? Patterns are actually more effective, more efficient, and make you better of an athlete, right? I always say that when you have an ACL tear, it's really a blessing in disguise. It's most likely the first time in your life, your athletic career, that you get a true 1 year break, that you get to work on the little details that you haven't worked on in a while, right? So, for example, with running, right? No one really sit you down to teach you how to run properly. They just kind of say, hey, that thing that you've been doing, which is running, go faster, right? And most of the times when I see any high level athlete from professional, college to high school, we all have some sort of flaw when it comes to running mechanics. So we like to use that opportunity to re-educate of how to run correctly, right? Sprinting mechanics, cutting, jumping, and landing. Those are also things that we like to go over as well, right? So this is how you get to actually reimagine yourself as a better version of your athletes, like as a better version of yourself. So I say it's a blessing in the sky because by the time you go back, like our team here's my kinetics is to make sure you're actually a better athlete, right? The statistic that we're fighting against is that, people who, tear the ACL, not many of them get to go back and perform as high level. But guess what? I don't believe in that statistic. I want to change that statistic. That's why we're doing this live stream today, right? Some of the other questions that they have too, there's two more. Are you confident in your ability to perform well in your sport, right? If you want to play at Division 1, and we have a lot of athletes in here, guys, that already have Division 1 offer scholarship, right? And they feel like they're going to lose their scholarship because they can't perform. Our job is to make sure that we push them at the level that they need to perform at a Division 1 level, right? If you're a high school athlete looking to play the next 4 years in college, we're going to treat you as a college athlete because those are the people you're going to be going up against, right? We want to make you better. We're going to try to dig that and pull that out of you during this whole 12 months process of ACL rehab. And lastly, do you feel relaxed playing your sport? This is a huge one, right? If you look at anyone that play professional sport and they're in the zone, it's look like they're making it look so easy. If you watching Messi, dribbling the ball, like running through, doing passes, it look like he's just having fun and he's not thinking. So that's a state that we call flow, right? Flow happen is when you can overcome your anxiety of the game and the pressure, and you're able to be yourself. Like Bruce Lee, any mixed martial artist can tell you that's like calling being in the zone, right? You want to be like water. So that way you're not all robotic, because when you're thinking too much or you're acting all robotic, that's when you actually are hindering your performance. We don't want you to be robotic. We want you to be flowing like water, which is a huge thing that we're trying to teach here, right? So those are the 12 questions we like to ask people, and we want to get them to 100% before we send them back into a game time scenario, right? So that's when you start competing, on your first game, your second game. Going back to how we get people back into the game. If you're able to do well in the scrimmage and you can get to full scrimmage, we'll do exact same thing when it comes to the game. We'll say, hey, coach, can we make sure so-and-so get 10 minutes in the game, right, per half? And then afterwards, we'll say, okay, can we increase that by 5 minutes next game? So now you get 15 per half per quarter, right? So you now increasing that intensity, that demand. And when you come back to us, you tell the PT, like, hey, by the way, I feel really good first quarter. Second quarter, I get fatigued really quickly. Can we work on that, right? And that's how we're going to dictate our game plan for you, right? Because our job is to get you ready to play at the next level and perform at the highest level possible, right? So that's how we usually get people ready to go back to sport. If you're feeling ready physically, mentally, and you have full confidence, the risk of you re-injuring yourself will go down to like the minimum, right? There's also a risk of you playing contact sport, people tackling you. That's something we have no control over. But guess what? We want to control everything that we can control when it comes to physical therapy, when it comes to dealing with ACL injury, right? So another thing I want to talk about too is when it comes to exercise selection, right? I like to say that the lifting, this training that you do in PT, you need to make that a part of your routine, right? Single leg training, Bulgarian split squats, single leg squat. And we did tons of videos on this of single leg exercise you can do at home. The reason we did that is that you can make that part of your routine. So if you're no longer in PT, you're listening to this, you're like a year and a half out ACL, you're feeling good, but you want to feel better, because you can always feel better. You can always do better. You want to do these exercises to make sure you actually stay on track, right? That you can actually keep pushing yourself, beyond your limits. So that way you can keep exceeding your expectation and build more confidence, right? So single leg strengthening exercise is absolutely number one, right? You want to get stronger. The stronger you are, the more resilient you're going to be, and you can withstand a lot of force. Number one. Number two, it's going to be balance. Single leg balance. Are you good at maintaining your balance on one leg? Can you maintain your balance by rotating your head side to side? Can you actually maintain your balance by juggling a ball? Can you maintain your balance by heading the ball? Can you maintain your balance by catching a pass? Right? These are scenarios that you're going to be using in real life and needs to be part of your routine every single time. Third thing will be your core strength, right? Are you doing core exercise, right? We're looking at predictors of people tearing the ACL, especially in adolescent female, right? Someone in their 14 to 16 to 18. Core strength is the number one risk, right? If you don't have good core control, because everything starts at your core, right? What I like to say is that your core is your main engine. Your extremities, your arms, your legs, right? Your head, that's an extension of your core. If you have really solid core, right, you can then maintain stability, produce pressure, produce force, and that way you can actually control your body when it comes to movement, right? So core exercise is huge. We have a core exercise series that we put on this channel, so that way you can go through and do those and make part of your routine, right? And then lastly, recoveries, which is absolutely massive, right? Most of the time when you're done with PT, your PT will say, all right, see you later. Good luck with everything, right? What we like to do here, we like to stay in touch. We like to say, hey, why don't you come in once a month for a checkup where we can get to do some hands-on work. We get to work on some weaknesses that you feel like you need to work on, right? Especially, if you pull your hamstring, if your calves are tight, that's going to change the way you play, right? You're not going to be able to play at 100%. We do this with a lot of our pro guys. So the pro guys, when they come to us, they come during in season, because in season is taxing, right? The way I like to look at any athletics event or season, it's like we're going on a long road trip, right? To go on a road trip, you need to have a full tank of gas. You need your tires to be good, so that way you can keep going, right? It's kind of like a pit crew. So our job preseason is to fill up that gas tank to as high as possible. In season, that gas tank can start going down, lower, lower, and lower. Our job of coming in to check in with the PTs is to make sure that we are filling up those gas tanks. It's like stopping at a gas station to make sure you don't run out of gas, because that's when injury happen, right? So if you feel like you're running out of gas, make sure you're reaching out to your PTs like, hey, I really want to get in. I don't feel the best. Like, I feel tight. I feel stiff everywhere. My joint feel a little achy. Like, can we just get in? Can we do some stuff, right? Here we do dry needling, we do acupuncture, right? We do cupping, we do all these things to make people feel back to baseline. That's the whole point. We want to keep filling up your gas tank. So those 4 things you need to keep in mind all the time as you're doing this, as you're going back to your sport, right? Like I said before, strengthening exercise, balancing exercise, core exercise, and filling up your gas tank by doing some hands-on work, connecting with your PT on a regular basis. That's the biggest thing that I would highly recommend that everyone do to decrease the risk of re-tear. Just because it's happened to you one time doesn't mean it's going to happen to you again. And it's my goal to make sure that doesn't happen again, right? And lastly, I wrote a book called The Complete Guide to ACL Rehab right here, right? Inside this book, I have exercise program that you can scan your QR code with, and you get access to all the exercises, right? We go from start to finish of how to go from like day 1 of ACL tear all the way to going back to sprinting, jumping, and landing, right? And I wrote this with the sole mission of to help eliminate the second ACL tear, because I don't want to see that anymore. And I make this as cheap as possible too on Amazon. So if you go on Kindle, it's 99 cents because I want you guys to have access to that. So you're watching this, go on Amazon, search up my book, get the Kindle version, scan the QR code, and you'll get all the exercise that we created, right? That I personally like, and I personally update, and I tailor like to all the athletic population I work with, right? This is something that you can do. It's a home program. You can do whenever you want, but as long as you have access to it, you can do something about it, right? So I want to close out this video by just saying this one thing to all the people that are listening to you. It's like, guys, it's not what happened to you, it's what happened for you, right? You are the byproduct of what happened. And what happened, it's not a bad thing, it's a good thing. It's the first time you face adversity in your life. And this is the first time you get to rise above that adversity, because life is all about that, right? And that's why this channel, the community I'm trying to create, is extremely important. I want people to comment there so that way people can connect it, right? Join the Reddit ACL Rehab community, because they're really good at that. Like I love talking to people on the Reddit community because they're so invested and they share each other on all the time, right? So again, we want you to start thriving on your own terms. We want you to actually exceed, perform on your best ability. And we want you to actually redefine your identity. You're not an injured athlete anymore. You are an athlete. You're an absolutely gem, right? You get back, you get to have your life back, and you get to do it better than ever. You have all the know-hows. You have the team to support you. And if you don't, you can reach out to us. You can join the Reddit community. You can get the book, and you have all these resources. And guess what? I'm here. I'm going to be doing the live every single week on ACL stuff. So that way I can go deep with you guys, right? Any question that you have, please let me know. And when you do it, I'm going to create content around that, because that's my sole purpose. I really want to help you guys get better from this, because again, it's not what happened to you, right? It's what happened for you. And I want to end off with that. So I hope you guys enjoyed this. If you like this, please share it to someone that you know. Like, subscribe to our channel, and then just leave a comment below what you want to see next. And if anything, I'll see you guys next week. Thank you so much.